Hi, my name is Dr. Jordan Carcaville. I'm a cosmetic dermatologist and Mohs surgeon. And today we're going to talk about CO2 laser resurfacing, what it is, how it works, and what to expect before, during, and after. So let's get into it. CO2 laser resurfacing treatment utilizes CO2 or carbon dioxide laser in order to create columns of tissue damage to your collagen to induce rejuvenation of the skin. It's commonly used to treat wrinkles, deep and superficial, to improve and even out skin tone, to help with acne scarring and other types of scars, whether traumatic or surgical. So next, let's talk about who's a good candidate for this treatment. The ideal candidate for a CO2 resurfacing laser is going to be someone who wants to improve their skin overall. So sun damage, pigmentation, scarring, wrinkles, those are great goals to have for the right patient. We do need to be careful with patients with darker skin types. Not saying you can't treat darker skin types, we just need to do it cautiously. And you need to be in the hands of an expert. So here's what happens during the procedure. So you'll first arrive at the office and we'll start by taking some photos of you. Then we'll have you wash your face and we'll put topical numbing on. The topical numbing will usually be on for about 45 minutes to an hour. Then you wash your face again, and then we'll often inject a little bit of injectable anesthesia to help you become more comfortable. If you feel discomfort during the procedure, you're awake the whole time and you can let us know. The procedure itself takes about 20 to 30 minutes, but do plan to be in the office for about 2 hours, including numbing time and post-cooling. Oftentimes, I'll combine this treatment with other treatment. For certain instances, such as acne scarring or treatment of a scar, I will often combine other treatments during your CO2 laser resurfacing. This might be subcision to release the fibrous bands of your acne scars. It could be TCA cross, which is a strong acid to help with lift up some ice pick acne scarring. And it could be combining it with fillers or collagen stimulators during the procedure. We often use PRP or platelet-rich plasma, which is utilizing your own blood. We spin it and use the platelets in the plasma to put on top of your skin right after the laser. It can help quicken healing and reduce infection. For a fractionated CO2 resurfacing treatment, I usually tell patients to expect between 5 and 7 days of downtime. Now, this might be healing skin, sensitive skin, red skin. So you're going to be needing to put lots of Vaseline on your skin and cleansing it daily with gentle cleansers or vinegar soaks. But expect to be a little bit red, a little bit sore, and that you have a few days, 5 to 7 days of healing. You want to make sure that you're avoiding direct sun. I usually advise to avoid direct sun for at least 30 days. Okay, it takes 28 days for the skin, the epidermis, to replenish itself. I also recommend to use sensitive skincare, especially in that first week. So don't start using your retinoids or vitamin C acids or other acids during that first week because your skin is too sensitive for it. So sensitive skincare only, and probably Vaseline or Aquaphor, a single ingredient emollient for those first few days. Just like with any procedure, there are always some risks that you should be aware of. There's always a risk of redness, swelling. Those are pretty much given, but there's a risk of infection. So if you feel any soreness, pain, or you have crust or pus, you want to let us know right away. There's also a risk of hyperpigmentation. And this is why we always recommend to be very careful of the sun, especially after the procedure. If you are prone to pigmentation, we'll often prep your skin with products leading up to the procedure, usually 2 to 4 weeks prior to your laser. So a consultation is important prior to these treatments. Fractionated CO2 laser resurfacing is by far and away my favorite laser treatment. You can get such great results as far as skin rejuvenation and improvement of texture, wrinkle, and scarring, which is important for a lot of people. If you're considering a procedure like this, make sure you're consulting with a professional or someone who's doing a lot of these. If you found this video helpful or you want to learn more, like, subscribe, or drop any questions or comments down below. Thank you so much.